Again, it's one of the bones. It's kind of like you can easily confuse with the maxilla, but we said this is here the palatal process of the maxilla. Now this one is called horizontal plate of palatine bone. Okay, so again, there's a palatal process and there's a palatine bone. So this right here, this is the horizontal plate of palatine bone. And there is the perpendicular plate of palatine bone. So do not confuse that with what's next to it. Is the medial pterygoid plate. Okay, so it's a little bit posterior to that. That would be the perpendicular plate of palatine bone. Now all of these two bones right here will form the hard palate, and that's basically the non-movable part of your palate. Okay, after that there's the soft palate. Okay, now with the palatine there are two major foramina also. There's the greater palatine foramen, this one, and there's the lesser palatine foramen. It's pretty tiny. And these are, again, just like the incisive canal, these are for nerves and blood vessels to go through them, okay, to the teeth. Oh, palatomaxillary suture is basically the suture that's between the palatine bone and the maxilla, which is basically this one right here. This is the palatomaxillary suture. So we said this one was the intermaxillary suture. This one right here is the palatomaxillary suture. Okay, mandible should be easier, hopefully. So this is the mandible. So we've got the body of the mandible. We've got the ramus of the mandible. Notch, mandibular notch. Coronoid process. Condylar process. Okay. Inferior border of the mandible. Angle of the mandible. Mental foramen. This is an oblique, external oblique ridge, or also called an oblique line. Same thing. Basically this one right here is an oblique line. If you see it like this, there's this little right there, and that's basically the mental protuberance. Okay, well, that's basically your chin, basically. Okay. Now next to the mental protuberance, there's two tubercles. There's two mental tubercle, and you need to feel that with your finger, which is basically this tiny part right here. There's one mental tubercle right here, and there's another one on the other side. Yes? Okay. Okay. Now if you turn from the inside, we'll see two major fossa. So there's the submandibular fossa, that's basically where the submandibular gland lives, and there's sublingual for the sublingual gland. Okay, so submandibular gland basically lives right there underneath your mandible. It's important because even a general dentist, they would need to feel for it. That's what Dr. Huber is gonna ask you to do, like really push hard on it, because you need to feel for, I don't know, like cysts, stones. You need to feel for lymph nodes, cancer sometimes, because all cancer or facial cancer are probably gonna drain into the lymph node in that area, right? So you're gonna really push hard on it, and that's where it lives. Right here, and that's what will be submandibular fossa. Now below your tongue and the floor of the mouth, that's where the sublingual gland lives, which is right there. That would be sublingual fossa. Okay. Now this here is the mandibular foramen, and that's where the bunch of nerves goes in, inferior alveolar nerve. And then there's the mylohyoid line, and that's basically where the mylohyoid muscle attaches to. And there's the mylohyoid groove right here. Also, there's a mental spine. Okay. Mental spine. Normally, mental spine, there are four of them. Superior, inferior. Here, I can only find one, but this is, oh, just kidding. No, don't delete that again. Okay, so there's a mental spine, which is this one, okay? Just for now.
There's only one?